Thank you, Crystal. Again, thank you everyone for being here, helping to spread the message. So today is our meeting for the regular bi-weekly COVID update. With me today are the Health and Social Services Minister, Julie Green, and Chief Public Health Officer for the Northwest Territories, Ms. Kandola, and Dr. Pegg is here as well to answer questions. I want to start off with updates on the situation in Fort Liard. Over the weekend, it was announced that there were confirmed cases of COVID-19, with the likelihood of more to come. In an effort to limit the spread of the virus, the Chief Public Health Officer issued a 14-day containment order for the community. The government of the Northwest Territories is working closely with community leadership and will be supporting all efforts to contain the spread of the virus. We've heard that there are concerns within the community about being able to get the information they need in the languages they need to ensure that they are well informed and able to make appropriate decisions. I've been in regular contact with Fort Liard leadership to make sure that the government of the Northwest Territories is supporting their needs during this critical time. Leadership in Fort Liard is working day and night for their residents. If the general public is looking for information on COVID-19, its symptoms, the current status of COVID-19, or rules and recommendations for folks in the Northwest Territories, first visit www.gov.nt.ca/COVID-19. If you prefer phone or you're having trouble finding information, please call 811. If you need to arrange for COVID testing, if you're not feeling well, or if you've been contacted as a result of a potential exposure, contact your local health center. There will be daily updates on the containment order that will be provided to radio stations, including the local community station, so please tune in for regular updates. The Nwt Vaccination Plan is rolling out across the territory. We've come a long way since March last year, when the pandemic created stress and uncertainty for many of us as to what our future would hold. It's been a challenging road to get to this point, but we're making significant progress in protecting residents and communities from COVID-19. We are moving in a direction where we will be able to further limit the spread of the virus and reduce the potential risk of significant impacts to our healthcare system. When my time comes to get the vaccine, I will book my appointment like other residents are being asked to, and look forward to playing my part. The Nwt business community is an important part of our territorial economy, and I want to thank those who have been working hard to protect residents and ensure that we are able to keep our numbers low. We know the restrictions in place have had a significant impact on the small business community, particularly in the tourism and hospitality sectors. And while it's been difficult, I'm encouraged by the innovation and resiliency of business owners who have found ways to continue to deliver goods and services that our residents rely on. The health and well-being of all communities and residents is best served by maintaining a stable economic environment. This will be achieved with continued strong public health response, enhanced pandemic services delivered by the COVID-19 Coordinating Secretariat, and the collective efforts of the private sector to adapt and respond to the COVID-19 pandemic. As the vaccine rollout progresses, many want to know when the public health restrictions will open up and travel restrictions will be lessened. We haven't made it this far on luck. We have listened to our healthcare professionals and have made decisions based on scientific evidence. Because of this, we have been spared the crushing cases and lockdowns in place elsewhere in Canada and around the world. I wish I could say with certainty when things will begin to open up, but we need residents and businesses to hang on a little longer. The light of the end of the tunnel is near, but many of the risk factors are beyond our control, and we need to remain vigilant. Protect NWT and 811 provide access for the public to critical services in our response to COVID, including self-isolation plans, exemption requests, and public health information. It's important for public health that these services provide consistent and clear communications in a timely manner. As you may be aware, Protect NWT and 811 were experiencing some issues with their phone system recently. The issue now appears to be resolved, but I encourage any resident to let the COVID-19 Secretariat know of any issue that you may be encountering. We're committed to delivering high-quality service, so please let us know if you encounter any challenges when calling our services. When the pandemic began, we moved quickly to stand up pandemic services that would protect the residents, like isolation centres. When the COVID-19 Coordinating Secretariat was established last fall, we committed to efficient and effective pandemic services. Understanding that there were economic opportunities that could benefit northern businesses, the Secretariat issued a public request for tenders in December for isolation centres in the 4 hub communities. I'm happy to report that a total of 76 standing offer agreements have been reached with northern businesses to provide accommodations, meals, alternative accommodations like bed and breakfasts, catering, security, and transportation services. By having several accommodation options, we're better able to meet the various needs of those accessing our services. This has, in some cases, allowed also a greater number of northern businesses to benefit from COVID Secretariat isolation centre opportunities in each of the hub communities. Last week, we also announced Statistics Canada is working in partnership with the governments of the Northwest Territories to conduct symptom checks in our isolation centres. The completion of mandatory symptom checks is a requirement of the NWT public health orders and part of approved self-isolation plans. If you have traveled out of the Northwest Territories, you are required to complete symptom checks on day 2, 6, 10, and 14 after you've entered the Territory. By completing regular symptom checks, the risk of transmitting COVID-19 is decreased. Statistics Canada staff are now working with Protect NWT by completing over-the-phone symptom checks with people self-isolating in the Territory. Statistics Canada is utilizing staff from the Western Canada region, which includes representatives from BC and Alberta, who are trained to make calls and conduct surveys to Northerners. So if you're wondering why someone is calling from a different area code and asking you questions about your symptoms during your isolation, this is why. Statistics Canada representatives are collecting this on behalf of the government of the Northwest Territories, and your information remains confidential. Again, I want to thank everyone for doing their part to continue protecting our communities from COVID-19. I'd now like to turn it over to Minister Green for some opening remarks. Thank you again for helping spread the message.
Minister Green, you can go ahead. Minister Green, do you want to unmute your mic on your side just to make sure we can hear you?
Okay. Good morning, everyone, and thank you, Premier Cochrane. I'd like to begin today's briefing by thanking all our frontline staff who are working to deliver the COVID-19 vaccine to our residents and to provide COVID-19 testing in each of our communities. The hours for this job are very long and difficult, and I truly applaud everyone who is a part of it. Before I provide an update on vaccine delivery, I'd like to speak to the report on social indicators, COVID-19 pandemic, that was released yesterday. The COVID-19 pandemic has had and is having a lasting impact on individuals, communities, and governments in the Northwest Territories and across the globe. The GNWT response to prevent COVID-19 infection has included a wide range of public health measures to prevent exposure and reduce transmission. Some of these measures have directly or indirectly produced unintended consequences, such as social isolation, loss of employment, diminished quality of life, or harms related to substance abuse. The report on social indicators COVID-19 pandemic examines the potential social impacts created by the protective health measures put in place to reduce the spread of COVID-19. It reports on indicators such as child maltreatment, mental health and addictions, alcohol-related harm, and family violence. So some of the key findings of the report include a decrease in child maltreatment reported during the first phase of the COVID-19 response compared to the prior year. Residents were accessing mental supports through the health system and anonymous helplines more frequently than through community counseling. Alcohol-related medical visits were higher in May, June, and July compared to the same months in 2019. Admissions to family violence shelters were lower in 2020 than in previous years, and there was an increase in the number of emergency protection orders issued during those months. When the public health measures were first implemented, the GNWT took action to reduce the risk of unintended consequences by doing the following things: establishing a working group to identify and interpret a variety of social indicators to examine the social impacts of COVID-19 and public health measures, increasing the number of virtual contacts with children and families to mitigate child protection concerns. We also sent letters to leaders asking them to note any safety concerns in their communities and to report to local child and family services offices. Increasing the frequency of our advertising for key services, such as family violence shelters, community counseling programs, and helplines, as well as moving to virtual supports where possible. And by providing short-term financial support to to families who cannot get assistance from other GNWT programs. And then finally, here in Yellowknife, providing services to vulnerable residents at the Arnica Inn, Aspen Apartments, and the day shelters. It's our intention to continue to monitor and address the gaps in communications and service delivery to ensure residents are supported during this pandemic. The data reported in this report will be updated quarterly to reflect the current status and to expand it to include other indicators as they become available. I would now like to update you on the progress we've made with our vaccine delivery. As of January the 18th, we have delivered 1,893 first doses of the COVID-19 vaccine in the Northwest Territories. This is a great number, and I applaud all of the vaccine teams who worked with local healthcare providers last week to bring us this impressive number. This number is updated weekly, every Monday, on the COVID-19 website, along with reporting to the Public Health Agency of Canada. I'm grateful to local healthcare staff, traveling vaccine teams, community leaders, and residents who are working together to protect the NWT from COVID-19. This is truly the Northern Way. Residents can get the most up-to-date information on vaccine clinics by visiting www.nthssa.ca COVID vaccine or Google NTHSSA vaccine schedule and you will find the information you're looking for. Depending on the community, priority populations may be offered the vaccine in phases or all at once. We ask for everyone's patience if the schedule needs to change due to weather or other logistical challenges. It's also important to remember that you need both doses of the vaccine, ideally 4 weeks apart to be considered immunized against COVID-19. Now that the Yellowknife COVID-19 vaccine clinics have opened up to residents 60 and older, I realize it has been challenging to get through and make an appointment. If you are unable to speak directly to someone or leave a message, please go to the NTHSSA website at www.nthssa.ca and click on Yellowknife Appointment Bookings under the Quick Links section of the main page. There you can fill out a form to request a callback. Public health staff is working extremely hard to answer all requests for appointments, and I can assure you that any eligible NWT resident who wants the vaccine will get one. Finally, I'd like to express my gratitude to the residents of Fort Liard who are following Dr. Kandola's containment order, and to residents across the territory who are coming forward for COVID-19 testing following recent public health advisories. You are setting an example for all of us, putting the health and safety of others first. I know how difficult it can be to be away from your loved ones or to be able or not to be able to gather as a community. I want to remind you that there are, of course, ways to connect while physically apart, including through phone calls, text messages, and video chats. And if you need some extra support, the NWT helpline is available 24/7 at 1-800-661-0844. That's 1-800-661-0844. All calls are free and confidential. I'll now hand it over to Chief Public Health Officer, Dr. Kandola, to provide the COVID-19 update. Thank you.
Thank you, Minister. I have a lot to report today, and we'll begin with an update on the 3 key public health investigations currently underway in the territory. So let's start with Fort Liard. Fort Liard is in the 3rd day of their 14-day community containment or lockdown. I ordered this on Saturday evening to control an outbreak of COVID-19. The order expires on January 30th at 10 p.m., but may be extended as necessary. We are continuing to classify this outbreak as a small community cluster. We know the source of the cluster relates to travel outside the Northwest Territories and was identified via Hay River wastewater testing. The individual with COVID-19 had self-isolated there and was tested in Fort Liard in response to our work to identify the source of the positive wastewater signal in Hay River, and that was communicated in a public health advisory on January 13th. To date, there have been 3 confirmed cases and 2 probable cases of COVID-19 in Fort Liard, all linked to travel. The number of individuals isolated in Fort Liard due to contact with the confirmed cases is holding steady at approximately 50. Our rapid response team, deployed to Fort Liard on Saturday, continues to work on the ground, supporting the local health staff to test, trace, and isolate individuals. As I noted on the weekend, there are a large number of contacts, meaning there is a much higher likelihood of there being additional cases and onward transmission. A number of measures were put into place this past weekend to assist Fort Liard residents in safely obtaining needed goods and services while in lockdown. This investigation is dynamic, and we will continue to keep people fully updated through Indigenous and community leadership direct outreach, and social media. So regarding our Hay River investigation, our Hay River investigation determines there is a high probability that the positive wastewater signal in Hay River was connected to the new cluster of COVID-19 infections in Fort Liard. Many people came forward this past weekend during the extended openings of the dedicated clinic. The clinic was to test people who are at any stage of their self-isolation in Hay River since January 1st. The Hay River team performed 189 tests since January 13th. I do want to thank again everyone who answered our call to be tested to help us identify COVID-19 cases related to this positive wastewater signal. And finally, I want to talk about Yellowknife. I'd like to update you on our active Yellowknife investigation to determine the source of infection for the positive case identified last week, and that case was not related to travel. To date, after identifying and testing multiple potential sources, we have not identified a source of infection. At this stage, there is no clear evidence of community transmission of COVID-19 in Yellowknife. We are not seeing any new positive tests, and our wastewater signals in our community remain stable at trace levels which are anticipated. We will keep everyone updated on this investigation as new information unfolds. I want to end my update on our active investigations by noting how this work underscores the importance of following all public health measures and for everyone to get their vaccines as soon as they're available to them. The vaccine will go a long way in protecting you from getting sick from COVID-19, and the sooner we reach high levels of vaccination, the sooner we will all be better protected. I would like to now present a vaccine update. As you know, I was honored to receive my first dose of the Moderna vaccine last Wednesday in Wekwedi, alongside chief football and community residents. I intended to wait until the vaccine was given to the territory's general population. However, after many calls from the public and leaders across the Northwest Territories to get vaccinated sooner, to set an example, and because I'm also a public health worker, I respectfully accepted the invitation from Wekwedi leadership to be vaccinated there. We do continue to hold regular meetings with leadership from the NWT Association of Communities as well as Indigenous governments. These meetings allow us to directly answer questions about the vaccine and provide updates on its rollout, which is unique to each community. I would like to provide a brief update from our call with Indigenous governments last week. Leaders feel encouraged by the rollout efforts to date. One of the most common questions was, what happens if residents miss the scheduled appointment for the second dose? While we encourage everyone to get their second dose 28 days after the first dose, we do understand that life, commitments, appointment availability, or weather may prevent people from getting their second dose on time. If the second dose is delayed, it should still be provided as soon as possible, and you do not have to restart the vaccine series if this happens. We will continue to follow recommendations from the National Advisory Committee on Immunization, NACI, and work with residents that require delayed second dose. The first dose will build immunity, even if the second dose is delayed. Across the Northwest Territories, we are seeing community leadership getting vaccinated and setting a strong example to their residents. Chiefs from Wekwedi, Kachlodichi First Nation, Deda, and Ndilo are examples of this. We are seeing local health staff go the extra mile to get residents to vaccine clinics. People like Stacy Kozak, who was a nurse in charge in Ulahaktuk, is an example. We are also hearing lots of stories of hope and excitement around this vaccine. One that stands out is from Lori Steinwood. She's a public health nurse who works in Hay River and was administering vaccines at Woodland Manor. She had some extra doses on hand after the residents and staff in the long-term care unit were completed. And she did begin calling out other priority residents to see if they were interested in getting the vaccine that day. And basically from her story, what she stated were people were literally screaming into the phone with excitement that they were in line to get the vaccine. So on the final vaccine note today, I'd like to share another important update to the NACI recommendations for the Moderna COVID-19 vaccine. Although research is still ongoing for people who are pregnant or breastfeeding, immunocompromised, or have an autoimmune disorder, these groups can receive the vaccine. The healthcare professional administering the vaccine will discuss the risks and benefits for the person before asking for verbal consent. We are doing our best to provide up-to-date information on vaccine delivery in the Northwest Territories. We post our vaccination numbers weekly, update the vaccination schedule regularly, and we will report out on achieving major milestones such as completing vaccinations of a priority group. The GNWT and NTHSSA websites are trusted sources of information about the COVID-19 vaccine. We are very fortunate in the Northwest Territories to be receiving enough vaccine for 75% of our eligible population. So again, I encourage everyone who is eligible to get the vaccine. Vaccine uptake and decreased rates of COVID-19 infection in the Northwest Territories and across the country will allow us to move through the different phases of emerging wisely. And I would like to end my remarks with another reminder of our best defenses against COVID-19. And it's those healthy habits we keep on talking about and that we're practicing right now. So I can't repeat enough the importance of everyone in the territory continuing to practice the healthy habits we know work to stop COVID-19. Stay home if you feel even a little bit unwell. Get tested for COVID-19 at the first sign of sickness. Call your local health center to arrange the test. Wash your hands frequently. Wear your mask when you're in public. Keep a physical distance of at least 6 feet between yourself and others. Keep crowds small and spaces large. Cough or sneeze into a flexed elbow or tissue. And self-isolate whenever required. Self-isolation is the most effective way to break the chain of infection and curb and prevent outbreaks. Thank you for your time.
Thank you, Dr. Kandola. So we'll open the floor now to media. As usual, please, one question, one follow-up, and I'd ask you to please come around here to the mic to ask your question. If you guys can also please identify yourselves and your news outlet prior to asking your question, that would be greatly appreciated. So we'll start with Blair.
This is Blair McBride from NNSL. This question is for Dr. Pegg. So on the presser on Sunday, you said that the vaccination clinic in Liard scheduled for Thursday and Friday, it could be hard to access for people who are isolating, and that officials were discussing possible solutions for that, like possibly coming back sooner than planned for the community's second dose. What is the progress of those possible plans?
Thanks for that question. So in response to the fact that there are anticipated to be a large number of people in Fort Liard isolating, what the vaccination team is currently working with the staff and those isolating individuals is to organize clinic times during the clinic vaccination or during the vaccination team visit to Fort Liard to ensure that individuals who are isolating, who do have a negative COVID swab and who are asymptomatic are still able to access vaccination during the visit of the clinic team, or the vaccination team, excuse me. We've also added another day of vaccinations where the team will be staying in place in Fort Liard in order to ensure that people who are wanting to access the vaccine can access it. And for those people who are isolating and are wondering about their particular situation as to how to access the vaccine, those who are isolating will be contacted individually in order to make arrangements for how those who are isolating can still access the vaccine during the team's visit to Fort Liard.
Yes, thank you for that. Also, on January 6th, you told the standing committee meeting that in small communities, the vaccination teams could visit people in their homes to vaccinate them if necessary. Is that something that's being considered currently for people isolating in Fort Liard?
It is one of the options that's being considered with the vaccination team if people are having difficulty accessing an external site.
Hi, my question is probably for Dr. Kandola. We mentioned that 1,800, almost 900 people have received their first doses of the vaccine so far. We don't have the numbers for how many per community. It's hard to say if that's good so far. So are you going to be giving these numbers, more details on these statistics? And more generally, is that on par with your objectives so far, that number?
So what we committed to do is once a week to pull the data and provide a weekly vaccine update. So the approximately 1,900 matches the size of the community that we were put as high priority. So initially we put long-term care facilities and the staff as priority and got them all done. We got 512. And then with the small communities, the ones that we chose initially as higher risk were the flying communities or the small cabin communities. So that number will be a lot lower than, in terms of population-wise, than the communities that we're doing this week. At this point, we've committed to provide the overall number once a week. Breaking it down into communities is not something we'll be doing right away, but when we get to the point where we're doing second dose and we have an idea of how many people fully immunized, then we can decide how we present the data. Some communities are so small, we may not be able to present it at that small level, but we can maybe aggregate it regionally. What you will see once a week now are the total numbers.
Perfect. We know that it's a hard vaccine to administer, to transport. It's, Moderna. You've mentioned it before. It's one of the most complicated vaccine we have to give in the territory. Has wastage been a problem so far? Having to throw away doses that are not stable anymore. How do we have numbers on that? And has it been a problem?
So, one of the things is with this vaccine, every vaccine is important, and so every effort is made that whatever is left in the vial, that we find people to give the vaccine to. So it's been very creative, and so the wastage has been quite minimal, because in every community that there are stories, or even in the bigger centers, is when they've completed with one group of people, just like in Hay River with Lori, if they have vaccines left over, they will call people to come get it. This happened in Yellowknife. In the other communities, there is ability to call people in to get vaccinated, or to be very careful with the amount of doses so that they can immediately vaccinate when they get back. We have to understand, and it's very hard when you're listening to the rest of Canada right now, a lot of them won't be have the same luxury as us until September 2021 to be providing vaccine to their adults. We have up to March to provide vaccines up to 75% of our population. And so we want to make sure that every vaccine is not wasted. Every vaccine goes into an arm, because it is such short supply across Canada, and it's our duty and our privilege to have received it early to make sure that we provide it to every single person who's eligible.
Thank you, Dr. Kandola. I'd like to give Dr. Pegg an opportunity to just discuss some of the vaccine rollouts that her and her team are responsible for that may help some of the questions we have for media.
Sure, thank you. So as has been mentioned in previous remarks, we have delivered vaccine to 16 communities in the Northwest Territories, with 17 communities either starting or due to start this week. Some of those communities are most difficult to reach and most vulnerable in terms of lack of health infrastructure, and we've been able to successfully deliver vaccine with our teams in a remarkable manner. We expect the numbers of vaccine administration to go up this week as we move into the larger communities for priority groups. And I will just take the opportunity to really applaud the work of our logistics and vaccination teams who've been able to move these vaccines into these communities and get them into arms where they're going to do the most good. Thank you.
Mariah, and I'll just ask you guys a reminder, please indicate yourself and your outlet. So go ahead.
Thank you very much. This is either for the Premier or Dr. Kandola. I'm Mariah, I'm from CKLB Radio. In regards to the probable cases in Fort Liard found yesterday, I'm very curious to know why we aren't tracking those in our COVID tracker. I understand we're very choosy and very particular as to which data goes in and which does not. Could you explain a little bit more about that? Whomever would like to take that question.
So in the Northwest Territories, we have the privilege to be able to provide point-of-care tests in every community. Fort Liard is no exception. So when we are following up on contacts or people with symptoms, we do a point-of-care test where we can get the result pretty much in that community. The advantages of having that is that you can immediately isolate that person and then look for subsequent contacts. And so you can start your case investigation. The drawback is with the point-of-care test, you have to have it confirmed at the Stanton laboratory. And so that's what we're in the process of doing. We have 2 probable tests, and they're in the process of being confirmed probably within the day, and then they'll be listed on the COVID tracker as lab-confirmed tests.
Perfect, thank you.
A follow-up?
As an aside, I understand certain provinces across the country are doing overnight clinics. So in the essence of if somebody misses their appointment and they're not able to get their vaccine, there are leftovers. I'd like to know if we have anything in place that if there's any leftovers that we have available for anyone else who is able to get them so they're not wasted or expired.
So our vaccination teams have been incredibly diligent in both ensuring that the supply of vaccine that goes into a community is as best adapted as it can be to the eligible population within that community, but also to make sure that if there are any doses left over at the end of a clinic vaccination day, that those doses go into someone's arm who is eligible for that vaccine. So as Dr. Kandola mentioned, we've been excellent at ensuring that at the end of each day, even if the priority population, long-term care, for example, or another group has been fully vaccinated and the people who are eligible, there is then a search put on in the region or in the facility in order to make sure that another eligible person receives the vaccine. So at this point, we've done an excellent job at being able to ensure that those are done within the hours of the ongoing vaccination clinics.
I am Bailey from True North FM. I think it's a question for Dr. Kandola. You mentioned there's been minimal wastage of vaccines, but I was wondering if you had numbers about how many people outside the priority groups that you've outlined have been getting, like yourself, who've gotten vaccines. I was wondering if you had numbers about how many people have been administered vaccines that are outside priority groups.
So if you, on the NTHSA schedule, if you look at the eligibility population for the communities that we went to, so the cabin communities and the flying communities, the eligible population is 18 and older, so pretty much anyone in that community could access the vaccine, so there'll be little wastage there. When you get into communities where there are priority populations, we're just rolling out that vaccine right now, and so what we would do is look for other people in the priority group, and if we don't, we'll find other people who are in a a lower priority group is still a priority group. So we don't keep track of the actual numbers of how many people follow up the vaccine. Priority groups, especially in the small communities when it was everybody, it was 18 and older when you look at the schedule.
Yeah, I think this is for Dr. Kandola as well. The wastewater samples in Hay River were from January 1st to January 6th, so it's been about 2 weeks since then. Are you on the verge of ruling out any COVID cases in Hay River?
So when we implemented the wastewater surveillance system, it was an elegant system that gave us like an early warning system to pick up cases that may not be presenting. So with the wastewater signal in Hay River, we had picked up a signal on January 5th and January 6th and again on January 11th. When we did our investigation on our confirmed cluster, pretty much most of that wastewater signal could be explained by the cases isolating there during that period. We have the most recent signal was wastewater collected on January 14th in Hay River, and that was a bear detect. And that was also an anticipated signal as well. So what we're seeing is that bright signal that we had initially has decreased in intensity to a bear detect, and we have confidence that pretty much most of that signal was explained by our current cluster. But we have to do ongoing surveillance for wastewater. Wastewater is something that surveillance we provide in, not only in Hay River, Yellowknife, Fort Smith, and Inuvik.
Kate Kyle, CBC. My question's for Dr. Kandola. Have you confirmed exactly how the case of COVID got to Fort Liard? Specifically, was the virus transmitted after the 14-day period, or perhaps this is the case that the individual may have left isolation early in Hay River?
So do we want to let Dr. Pegg maybe talk about the response team reaction?
So what we know is that the cases are fully isolated in Hay River, and during that period of isolation there were symptoms, and so which led for the initial case to seek testing, and that led to the subsequent contact tracing and finding of further cases.
So symptoms in Hay River, went back to Fort Liard and got tested. Is that correct?
That's how it was detected. But the what I can say is everyone completed full isolation.
Okay. So I do think let's give Dr. Pegg just an opportunity to talk about what response team does in those instances, so not specifically to this case, but just in general to give residents an idea of how that rolls out.
So, as you heard on the weekend with the notification of the confirmed case in Fort Liard, there was deployment of a rapid response team from the Northwest Territories Health and Social Services Authority to Fort Liard, in addition to the response that was rolled out in Yellowknife in response to the ongoing investigation for the positive case. In collaboration with the Hay River Health Authority, there's also been an increase in testing and a capacity to increase testing within the community of Hay River in response to the wastewater signal. Fort Liard being the most active region right some of those have been rapid point of care tests for those who are at highest risk of being in contact with a case. All tests are sent to the Stanton lab in order to have confirmatory testing, whether positive or negative. And there has been great collaboration between the health centre staff, the rapid response team, and other areas of local community infrastructure in order to support the people who are isolating and to support the community of Fort Liard as they mount a really amazing response to the call for the containment order and the response to the cases detected in that community.
Yeah, just in terms of the isolation centers, do we need to see more testing before people leave or checking in on them to see if they have symptoms? Is anything changing because of this case?
As the Premier mentioned, we have Stats Canada who are now actively reaching out to everyone in self-isolation, whether you're an essential worker or whether you're a resident or visitor. And so they will reach out and contact you in day 2, day 6, 10, and 14. And if anyone has symptoms, that they are required to call the healthcare center and get tested. The other approach we also are doing is when you have essential workers who are coming into the territory and they have to start on day 1, we're doing more targeted screening of essential workers just on day 1 and more frequent intervals depending on what type of essential work they do. So we are increasing our screening and we're increasing our direct symptom inquiry. I think those two will be helpful. And don't forget wastewater. It's our best signal.
Premier Cochrane, did you want to touch on that at all?
I think Dr. Kandola gave a good answer. The only thing I'd expand on is that we are doing our best to make sure that everyone in isolation centres is getting appropriately screened. Like Stats Canada, huge shout out to the federal government for helping us with that endeavour. The more people we can get helping, the better off. But it is really important that everyone within the isolation units please abide by the orders. They are allowed to go out for walks. They're not allowed to be around people, go into restaurants, bars, shopping centres, but they are allowed to go for walks and get some fresh air. So as long as everyone does their part, we should be fine. Thank you.
Hi, my name is Marie-Soleil Deshotel and I'm here for Média Ténois. I have 2 questions. The first one, probably Cochrane or Kandola. Since the government no longer covers the cost for the isolation center,
Thank you. So currently we're covering the cost of isolation centres for anyone outside of vacation travel, leisure travel. So people that are medical, our students coming back, people that are exceptional situations. We are trying to accommodate. We also have a exceptional situation. So if people do have problems self-isolating, contact us and let us know. We're not here to penalize people. We're here to actually support as many as possible. But it is important that people try to limit their leisure travel out of the NWT. If you are looking at leisure travel, please look at where can you isolate when you return. Factor that cost into your planning would be the best advice. But if you are stuck, we definitely don't want people to be putting the community at risk. Contact us and we'll see what we can do to help. Thank you.
Regarding the roadblocks that we see in the last few days, do you think people are overreacting?
Thank you. I think that people are afraid. And I think people are tired. We've been dealing with COVID-19 for almost a year now. And at the very beginning, communities did put up checkpoints to make sure that people were coming in, knew what was happening. Legally, they're not allowed to put up roadblocks. They are allowed to put up checkpoints, though. And again, whenever they do that, we try to work with them to let them know what legally they can do, provide information to them. Again, it's community leaders trying to protect their communities, and anything we can do to support them with that without allowing them to break the law or to put up road checks. People are not, even our task force, our border patrols are not allowed to search vehicles. We have limitations. However, we will call the RCMP if necessary. So we're working closely with the RCMP, whose job it is to make sure that people are obeying the law, and then community leaders, we will support them, but we are not condoning road blocks. We're condoning if they want to do information checks. Thank you.
Hi everyone, I'm Sarah Sibley from Cabin Radio. I think this question is for Premier Cochrane, but from my understanding in Fort Liard, the grocery stores have been closed for the past 2 days doing curbside pickups, and 811 has experienced some issues, some backlog. So who was the onus falling on to make sure that people got the proper information in the languages that they speak of this small community cluster that we're seeing in Fort Liard, and how do we know that everybody has been reached?
Thank you. Again, I want to give a huge shout out to the Hamlet of Fort Liard for supporting us with this endeavor. They've been working with the grocery stores as well, like stated. The grocery stores, there's 2 in the community, is my understanding. They've been giving curbside services. They are looking at a longer-term solution for that. Information was an issue, and so right through it, we've tried to translate as many of our brochures, posters, everything into the 11 official languages. Within that community now, we've developed the material. So we're using the community radio. Please listen to the community radio as much as possible, people in Fort Liard, for updates. We're using posters that we've developed. We're working with the leadership. I'm constantly phoning them. And the other thing that we're doing starting today was we have an information sheet that talks about what you need to do to self-isolate, how to keep yourself and others safe. And we've actually contracted with someone within the community, from the community, that speaks their language, that is actually going door to door and knocking on the doors. So that is, we're trying to do everything we can to get the information and to reach as many people as possible. Thank you.
And I think my follow-up is for Dr. Kandola, just going off of what one of my peers said earlier. Can you just go a little bit more into the timeline of when somebody in Fort Liard gets tested and when it may be confirmed here in Yellowknife, how long that may take, that process?
It's operational.
So, as you know, there are geographical limitations involved in getting goods and various other items in and out of some of these communities. So the point of care confirmatory test, there are charters going in and out of Fort Liard every day, and samples that are collected in Fort Liard go back to Yellowknife on those charters. The actual turnaround time does depend on lab volume, but so far has been less than 48 hours.
Okay, we're going to end it there. So thank you to media for joining us this afternoon.